AI-powered clinical documentation tools have been one of the greatest weapons that hospitals have to fight the clinical burnout crisis that's happening right now. These tools listen in on the patient-provider interaction and then produce a clinical note so that providers don't have to spend so much time on documentation and billing tasks after their shifts are done. This has proven to be pretty successful in increasing retention and reducing burnout among physician populations, but nurses haven't really had the same access to these documentation tools. Now, nurses make up a lot more of the clinical workforce than physicians, and they have a heavy documentation burden too, but it's been harder to incorporate these tools into their workflows because nurses aren't really in the habit of narrating their care out loud. So it takes a little work to integrate these types of tools into their day-to-day work, but that is starting at hospitals all around the country. One documentation AI startup, Abridge, held an event in New York earlier this month with a lot of their customers, and I was able to talk to a few of their health system customers who are deploying this amongst their nursing units, and it was really great to hear that they are starting to take the steps to integrate that technology into nursing workflows. So here's a little bit from Misty Faust-Cofield, who is the Chief Nursing Officer at Reed Health, which is a rural health system in Indiana and Ohio.
One thing that really sticks out to me after talking to the team that I'm privileged to serve was the cognitive burden that they are seeing with the plethora of notes and documentation and things that they have to do as nurses, because as nurses, we're at the tip of the spear. So everything that has to happen with that patient, we are the ones who coordinate and make sure those things occur. So a lot of tasks that we have to do. And one thing that we have most certainly noted is that with Abridge, we've been able to decrease the amount of time that our nurses are in the physical chart by 30 to 45 minutes per shift per nurse. So that's time that they're able to give back to our patients. That's time that they're able to actually get out of work on time to enjoy events with their families and their children. So that has been very, very special. Another thing that we have seen is before our Bridge implementation, our RN vacancy rate was 18.4, 18.6 in that area, and we've been able to decrease that to 8%. So from 18.4 or 6% to 8%. So we've seen a 10% decrease in our vacancy rate. And also we have seen a multitude of new nurses that have wanted to come and be part of our teams because they see the investment that we're placing in the emotional and mental well-being of our clinicians by investing in progressive and innovative tools. So it's an environment that they're excited about and they want to be part of.